So about a year and a half ago, on the federal level, there was federal legislation passed that said we're going to make a 3-digit number for mental health emergencies. And there had been a lot of policy work and lobbying for that for many, many years. And it was just a huge, exciting time for that to have passed federally. So when that passed, in reality, what it did is it said there will be a 3-digit number, 988, that can be called from any landline or any cell phone, and you will reach a person to talk to. Now, in many states, what happened was that the National Suicide Hotline became where 988 connected to. Okay. And so they didn't necessarily change anything in their state, except now you had another way to reach it. But we really looked at it here in Oklahoma and said, this is a huge opportunity. We could do so much around having this 3-digit number. Mm-hmm. So we started then really crafting out what we wanted it to look like here, and are in the process of developing a continuum of care. So what we did get put in place for when the number went live, which was July, is to have one call center where this came in. Mm-hmm. And throughout that call center, it could link you to many things. It could give you information if what you're looking for is a place to go for help and treatment. It has a warm line, so if what you really want is just to talk to someone, mm-hmm.
You're not necessarily saying I'm in crisis, but you're saying I've really got some things I want to talk about.
Yeah.
All the way up to an imminent crisis. I have thoughts of harming myself. I have a plan. I am on the verge of acting on it. Help me. Or a family member or a friend of someone who wants to call and say, I don't know what to do. I saw this text. It's very scary. I think something's going to happen. So for any and all of those types of things. Also the ability to connect to additional hotlines from there if needed, if more specificity was warranted. So it will handle the immediate crisis, and then perhaps if it's identified that it should go a gambling track, then we'd go the gambling hotline way. So it can connect through everything. But in addition, being able to have mobile crisis teams that can go out across the state when appropriate, and to have persons trained to understand when that's appropriate and when it's not, and just to be able to have everything at people's fingertips. Now, also we knew, in addition to this, we needed to have more places for people to go if needed. So we've been building an infrastructure of urgent care, psychiatric urgent cares, and crisis units for folks to go, along with upcoming more hospital beds to meet the need and the demand. Because in Oklahoma, one of our most stubborn issues has been the suicide rate. And we've seen very little movement in that through the years. We saw a little bit of a downward trend right before COVID, and then COVID, of course, has pushed things back up. So knowing that this could be a way in Oklahoma that we could finally get some real solid traction around reducing suicides by having this one easy number that connects you to an entire continuum and infrastructure to handle what is going on.
Yeah.
And then the other piece that's really important is that there is always a closing of that loop. So if you called today and mobile crisis came out, or you talked to someone and had a referral for a local treatment provider, or you went into a crisis unit, then that call center is going to follow back up with you. Hey, was that helpful? How are you feeling today? Is there anything else that you need that we can help you with? So having that just continued connection afterwards to make sure that you get what it is that you need is incredibly important.